Hi there. This is Dr. Raj Kakar again. Great to see you, and thank you for taking the time. Today we're going to be talking about why is sleep apnea important. And so really it's important for people to understand why we treat sleep apnea and why it's such a big deal. Well, the reason being is that sleep apnea can contribute to a litany of other health problems. And I'm going to go through some of those with you today. Some of the more common problems that sleep apnea contribute to is high blood pressure. Hypertension or high blood pressure is directly caused by sleep apnea. So sleep apnea can lead to high blood pressure, which can then require medication management for managing blood pressure. So that's a big one. Another thing that sleep apnea can contribute to is atrial fibrillation or AFib or cardiac arrhythmias. And what that means is that your heart goes into an irregular rhythm or beats irregularly, and that really increases somebody's risk for stroke because you can end up having a blood clot that goes to the brain or the heart, which can lead to a stroke or a heart attack. So having an arrhythmia, cardiac arrhythmia like AFib, is a really significant risk factor for stroke and heart attack. And what can directly contribute to AFib or other cardiac arrhythmias? Sleep apnea. And that's again because of the stress that sleep apnea puts on the heart during the night because when somebody's struggling to breathe. That's another biggie because once you've had a diagnosis of AFib, you have to have medication management. You may have to have your heart shocked back into a normal rhythm. It entails a lot of other things in addition to increasing risk for other serious health problems, which can be devastating. In addition to these couple of items, sleep apnea increases the risk for weight gain and obesity. And that's because many sleep disorders or disturbances contribute to poor quality sleep, which then contributes to weight gain and obesity. As a result, poor quality sleep, feeling excessively tired and fatigued, as well as the way it affects our hormones and our metabolism, that it actually makes it very easy to gain weight and very difficult to lose or maintain a healthy weight. Sleep apnea and sleep disturbances can definitely contribute to weight problems, including obesity. Another thing I'd like to point out is how sleep problems, including sleep apnea, can contribute to mood disorders. Mood disorders like anxiety disorder and major depressive disorder or depression, these can also be associated with untreated sleep apnea and are oftentimes exacerbated by sleep disturbance. And they go hand in hand. We've seen that people who have anxiety or depressive mood disorder are at increased risk for sleep problems, and vice versa. Sleep problems like sleep apnea can directly contribute to the development of anxiety and depression. So it's a very vicious cycle, and it can really make somebody feel just exhausted, unrefreshed from sleep, excessively sleepy during the daytime, and even fatigued. So it really has a huge impact on our mental health. In addition, sleep problems like sleep apnea and snoring can contribute to social problems because when somebody's snoring loudly and frequently, that can definitely cause problems in the bedroom. A lot of times partners or spouses getting disturbed from their own sleep by the person next to them snoring loudly and disrupting their sleep. They can also get concerned about them because they see them struggling to breathe at times. And so that puts a lot of stress on the partner or spouse who's witnessing this because they're really the first person to realize that this is a problem. And so it can have an impact on the social relationships and can even lead to bed partners sleeping in separate rooms. So it has an impact in that regard too. And lastly, I'm just going to mention the most common symptoms of sleep apnea include number one, snoring, of course, witness snoring, although the person who's affected is usually the last person to know that that's a problem. Then other common symptoms of sleep apnea include difficulty falling asleep, difficulty staying asleep, waking up frequently at night. In many cases, waking up frequently to go to the bathroom is actually a symptom of sleep apnea. In men especially, it gets tricky because a lot of time once men are, in their 40s or 50s, we start to think about prostate enlargement as a possible reason why they're having to get up to go to the bathroom a lot. And in some cases, that may be true. But there's also cases where we find that if a man has sleep apnea, that could be the underlying reason that they're getting up so much to go to the bathroom at night. So a lot of times that may not be diagnosed right away. So it's important to keep that in mind, waking up frequently to go to the bathroom, both in men and women. That's a symptom. Unrefreshing sleep, waking up feeling tired or unrefreshed from sleep. on a fairly regular basis is another red flag that somebody may have sleep apnea. Waking up with headaches in the mornings. Headaches are somewhat common in people who have sleep apnea. It doesn't happen in every case, but occasionally somebody may have headaches. And part of that is due to just not sleeping well. Part of it is due to not getting enough oxygen to the brain. Because again, with sleep apnea, you're not getting enough oxygen to the body, which also includes the brain, and that can contribute to morning headaches. And then, of course, daytime symptoms can include excessive daytime sleepiness or just drowsiness during the day. It can also contribute to fatigue or feeling just tired a lot. And so those are also symptoms of sleep apnea, which are very common. And most people will try to cope with that by drinking more caffeine and those types of energy drinks to help them stay a little bit more alert and awake. So these are some of the common symptoms of sleep apnea, and so I thought I wanted to share that so you understand why it's so important, not only affecting somebody's sleep quality and their daytime energy level, but big picture, it can definitely increase somebody's risk for other health problems, including high blood pressure, heart disease, weight gain, obesity, diabetes, depressive mood disorder, anxiety disorder, and one more I didn't mention is your brain health. Sleep problems, including especially sleep apnea, has been shown to affect memory and concentration. And so there's more and more research now that's showing that obstructive sleep apnea and sleep problems long term, if untreated, can lead to dementia and memory problems. So that's another biggie as to why sleep apnea is so important, is because over time, if left untreated, it can increase somebody's risk for dementia. So I hope you found this informative and helpful. And next time, in the next video, we're going to talk about the treatments for sleep apnea. Fortunately, there are treatments for sleep apnea. And these treatments can be very helpful to manage and effectively treat the sleep apnea. So we'll talk a little bit more about those in the next video, and then we'll have further discussion. So thank you again for joining us, and have a great day.